Hi guys. Today we'll be discussing meningitis. I will be explaining to you what meningitis is, what causes meningitis, what part of the brain does it affect, its symptoms, the treatment for meningitis, etc. So let's start. So first of all, uh, to understand what meningitis is, we first have to know what the meninges is. So the meninges is a system of membranes that covers the central nervous system. Specifically, it encircles the brain, and it is there to form a barrier that protects the brain. And there are three layers of the meninges. So we have the first one, which is the dura mater. This is a Latin term which means a tough mother, and the it has this name because the dura mater is very thick and is very strong, and it's the first layer of the meninges. And then the second one we have the arachnoid matter. so um, the arachnoid matter has this name because it kind of resembles a spider. Is it has branching memory that looks like the legs of a spider. So that's why it's called the arachnoid matter. And there's the last one is the pia mater. The pia mater means gentle mother. It's a Latin term meaning gentle mother, and this is because this is uh, a very delicate memory. So yeah, we can see the three layers of the meninges. So this is the dura mater. Yeah, we can see how thick it is, and under it we have the arachnoid mater, and then yeah, this entire place, this is the pia mater. So now we also part of the meninges is the subarachnoid space. This is the space that exists between the arachnoid mater and the pia mater. Right here somewhere here, and this is filled with cerebrospinal fluid. Cerebrospinal fluid, or CSF, is very important. One, it forms the blood-brain barrier, and it serves like a kind of a shock absorber to absorb um, to absorb forces or trauma to the head. And this is very important, and later on we'll understand why. Now, what is the clinical description of meningitis? So basically, meningitis is inflammation of the protective membranes covering the brain and the spinal cord, known as the meninges. So the first part of this name, meninge, comes from meninges, and then the second part, sorry, itis meaning inflammation. So the inflammation usually is caused by an infection of the fluid surrounding the brain and spinal cord, that is the CSF, or the cerebrospinal fluid. Now, meningitis is a very serious illness, and once a person catches it, it can be life-threatening, and it's very important to seek medical uh, medical attention right away, or you could potentially die. So, uh, they, there are different classes of meningitis. One, we have acute pyogenic meningitis. This is a type of meningitis that is caused by bacteria. The second one is aseptic meningitis, which is usually caused by viruses. And the third is chronic meningitis, which is caused by tuberculosis or fungal. Meningitis also can be caused by blunt force trauma to the head. Now, the causes of meningitis, like I was saying, there is bacterial meningitis caused by different types of bacteria, viral meningitis, fungal meningitis, parasitic, and physical injury like blunt force trauma to the head, cancer, and then certain drugs like NSAID drugs, and these drugs are These are non-steroidal anti-inflammatory drugs. These are drugs that are usually taken to reduce pain or fever or blood clots. And sometimes when the dosage is not right, they can lead to inflammation of certain membranes. And head injury also can cause meningitis, cerebral abscess, or even middle ear infections. Now, what is the pathophysiology of meningitis? So first, the causative organism enters the bloodstream. This causative organism can be a bacteria, a virus, or fungus spores, or whatever. And once infection enters the bloodstream, we know that the scientific term for that is sepsis. Now, once this infection crosses the blood barriers, the meningitis in response to this, to protect the brain, there usually is an inflammatory reaction, and then the inflammation of the subarachnoid space and the pia mater occurs. Then next, inflammation causes ICP. ICP stands for intracranial pressure. This causes CSF or cerebrospinal fluid. Sorry. This causes CFS or cerebrospinal fluid to flow into the subarachnoid space. Once it does, the CSF becomes infected, and this can manifest as a cloudiness of the fluid. Usually the fluid should be clear, but then it becomes cloudy. And then in response to this, the cells of the CSF usually increase in number to help combat the pathogen. So I want to show you a picture at the beginning of my PowerPoint. This one, this is a picture of a brain newly during an autopsy. The patient died of meningitis. So usually this is the meningitis, the covering of the brain. Usually it should be clear, but we see here that it's like cloudy in appearance. This is because the meninges have been infected with bacteria or whatever. So that's why it has this coloring. So let's go back. Now, what are some signs and symptoms of meningitis? So the first one is severe headache, um, irritability, restlessness, stiff neck, malaise, or let's say low energy, nausea or vomiting, high grade fever. Next is tachycardia, which is very abnormal and rapid breathing. And then we have seizures, disorientation, tachycardia or very rapid heartbeat, and sometimes it can even progress to coma. Sleeplessness, phonophobia or abnormal reaction to noise, photophobia, abnormal reaction to light, and then confusion. So a combination of these symptoms may suggest that a person has meningitis. Now, what are some complications that are involved with meningitis? So the first one is, of course, brain damage, especially if meningitis is not treated and it stays for a prolonged period. It increases the chance of brain damage. And then we have cerebral edema, also known as swelling of the brain, and then hearing loss and brain tissue damage. Now, what are the treatment for meningitis? So of course, if once to diagnose, usually doctors do a spinal tap, which is they take fluid from the spine, CSF from the spine, to determine if, and then they culture it, for example, to know if it's bacterial meningitis or viral meningitis or fungal meningitis. Once they know what type of meningitis that is, and then they can treat it. So for bacterial meningitis, it requires the use of antibiotics, and the type of antibiotics used can vary depending on the type of bacteria found to cause the infection. But then antibiotics, as we know, are not effective against virus, so they have to use antiviral medication to treat viral meningitis. Then also they have to treat the symptoms of meningitis. So they have to reduce the brain swelling. They have to for shock they have to give intravenous fluids and medication for seizures. So how can you prevent meningitis? So now there's a vaccine for meningitis, the hemophilus vaccine, that is given to children to help prevent meningitis. And then the pneumococcal conjugate vaccine is also administered in childhood to prevent this type of meningitis, pneumococcal meningitis. And also meningococcal meningitis is kind of contagious. The bacteria that causes this can spread from person to person. So once a family member is sick, uh, people who have come in contact with that person have to receive preventive antibiotics.